system were built around the needs and preferences of the people receiving care and not the providers? What if Nathan, a 34-year-old father and husband who's working 2 jobs to take care of his family, what if he could get his health care in the community? What if he could get his blood pressure taken care of, advice about how to prevent disease, how to make sure that he didn't die suddenly as his father did? What if he could do that in the community, in a place where he felt comfortable and not vulnerable? To get to this place for Nathan, we certainly have to change the healthcare system. And I think a key piece of that is working with community organizations. We have to not just do that, though. We have to look within ourselves and think about how we can earn their trust and be more trustworthy. That's the only way we're really going to get the system to evolve and get to a place where we can think beyond what our needs are as providers and health systems and get on to changing the lives of our patients. There's certainly been recent progress towards changing the healthcare system and making it more available. We have mobile clinics, we have extended hours, we now have health clinics that are embedded in retail pharmacies and in groceries, but it's far beyond just location and hours. We have to begin to embrace the fact that people live in communities that are important to them, and we have to begin to embed ourselves in these communities. As long as we remain siloed, we will continue to have poor outcomes, especially among the most vulnerable. Let's face it, though, our system is still structured around supporting clinicians who are providing services, and that's how they get paid. We're not getting paid to keep people healthy. We're getting paid to provide health care. So if our goal is to get people healthy, then we've got to change the dynamics here. What if, instead of thinking about working with the community as community benefit, what if it were a strategy? What if, in addition to office visits and ordering tests, working with the community were a strategy, not charity? What if we valued their assets and resources and the knowledge that they bring to the table? Perhaps then we could begin to address the 60 or 70% of the drivers that are impacting health. What if we began to recognize that saying the word social determinants of health is not going to change how we manage care? We have to begin to not just recognize these as important, but recognize that we have a role as health providers and health systems in solving these and providing access to those. Most of my colleagues are well aware that social determinants are important for health, but they think it's somebody else's problem. It's not theirs. It's not something that they get to do or address in the 11 or 12 minutes of care, maybe even less than that. So how will we extend our boundaries? How will we evolve the healthcare system so that we're providing health services, not just healthcare services? I'm pleased to share with you today some of the insights that I've gained as I've had the honor and privilege of working with many community organizations over the last 15 to 20 years. In our Meharry Vanderbilt Alliance's interprofessional education program, an initiative with faculty from 11 different disciplines from Meharry, Vanderbilt, Belmont, Lipscomb, Tennessee State, we partner with community organizations to solve problems that they identify, not problems that we identify. We work with community organizations not in a clinical setting, but in one where the community brings a problem forward, the students present their ideas, and the community organization actually ranks the students. They decide who they want to work with. Some of our community partners include the Oasis Center, which is focused on providing skills and training to teenagers, many of them runaways or addicted to drugs, providing these services so that they can become thriving adults. Urban housing solutions, which focuses on affordable housing. Dismiss House, which is a program helping support former offenders who are transitioning out of prison. Or St. Luke's Community House, which provides preschool services, after-school programs, meals for seniors, computer literacy training for older adults. Now I know for some of you that list sounds a little overwhelming. Maybe I have too much time. For others of you, you're thinking, this is still just not connected enough to healthcare. It's too far beyond the current boundaries. But the big picture is we're taking on housing. We're taking on food insecurity. We're taking on the alienation that has become so much a part of our daily lives. Our community partners are just that, partners. They're not agencies that we go to with our great ideas and all of our academic intellect and ask them for their space or access to their clients. They work with us. They help design the program. They tell us what they want. They tell us what to do. They're even co-authors on academic publications. It's probably not that important to them. We pay them. We respect them. We invite them to the table. And when our students have been evaluated in this interprofessional education program, they have made progress. They've made improvements in their scores on these traditional measures of interprofessional education. But what they've also done is learn about social determinants of health. And they now feel more prepared to take care of the most vulnerable patients. So that's the key piece that I've learned, is that not only are community organizations important, but they're absolutely critical. They're crucial if we're going to do this work. We have to begin to embrace their knowledge, their assets, and incorporate them into the plans that we make at the beginning, not at the end. I've learned that trust, especially trust among the most vulnerable populations, is closely linked to whether people perceive that they are being treated fairly and that they will be safe. It's not about how many degrees we have, how many awards we've received, or the prestige of the institution. It's about whether or not people believe that we are trustworthy. Do we deserve to be trusted? Now that's something that's taken me way too long to fully appreciate, and I'm sure my mother would be disappointed about how many degrees I had to get to realize that. But I had the opportunity firsthand about 18 months ago to see the true power of community organizations when we were seeking to get input on our precision medicine initiative, which is going to have 1 million people across the country involved in this longitudinal study. So our team was tasked with getting input from many different populations. We needed to understand what their preferences and needs were, what their views were on this new emerging space of precision medicine. In less than 6 months, we held 77 face-to-face roundtable sessions from Miami to Rochester to New Orleans to Sioux Falls, South Dakota to Southern California. To accomplish this, we didn't send out flyers that said Vanderbilt and Meharry are coming to town. We worked with local community organizations who recruited their patients, not patients, clients, community members to come, and they hosted these roundtables for us. We call them community engagement studios. We paid the community organizations to help us do this, but we didn't just ask them to do what we wanted them to do. We wanted their input on how to create the flyer, what's the best way to communicate with their clients or their communities, and we respected their advice. If they told us to have the session in the morning, we held it in the morning. If they told us that we should order food from the neighborhood store and not Panera, that's what we did. That's the second lesson, cultural humility. We must recognize that if we are going to work with the community, we have to be humble enough to realize that we don't know everything we need to know about the people they serve, and we need to be ready to and willing to gain that knowledge. Different from cultural competence, cultural humility requires that we look inside, that we are willing to change the way that we think and the way that we value these unique characteristics of individuals. Although we've been very successful with establishing authentic partnerships in the community, to expand beyond this boundary, we have to, again, truly integrate with these communities. And I think the solution, or at least one of them, is we must co-locate services within these communities, within the community organizations. It shouldn't just be a referral to them. We must be embedded in the community in order to see some change. So again, what if Nathan could get his care in the preschool where he's picking up his kids or dropping them off? What if he could get his care at the community center on the weekends when he's playing basketball or taking classes? What if he could get his care in the church on a Sunday? What if we pick up our laptops and our stethoscopes and go to the community? Thank you.